Hi, everyone. We'll get started shortly. Hi, everyone. My name is Ashurjit Dutta, and I'll be giving this webinar today. So this webinar is on data quality, and I'll discuss some of the key principles that we'll be going through and give a brief outline before we get started. Hopefully, we can have a bit of interactivity today. You can ask some questions, and I'll try to engage you as well in other ways. So let's get started here. So just to give you an outline of what we're going to cover in today's webinar here. So we'll go over first an introduction to the Data Quality Toolkit in DHIS2, so what that actually is and what it includes. And then we'll actually just speak about all the different kind of metrics and procedures that we've outlined within this toolkit. So basically, we've broken up the way we look at data quality into several different kind of processes. So we start with kind of preventative measures, basically kind of ensuring that the data coming in to the extent possible is prevented from being of poor quality. We then have identification, and this is probably where many systems are at. There's a lot of data in the system, and you need to review it, and you need to kind of identify what's wrong and fix it somehow. We also have some discussion around the actual fixing of these issues. So how do you actually do that, and what are some procedures around that? And then once those fixes are implemented, or even once you've come up with strategies for fixing these data quality issues, how do you monitor whether or not those data quality issues have been fixed over time? So we've basically kind of broken things up into those four processes, and we'll discuss that. And then in addition to kind of the discussion around the data quality metrics and procedures, we'll discuss some implementation practices as well in terms of how you actually get this up and running. We won't talk too much about configuration necessarily, but we will speak to how you actually kind of set up some procedures and some best practices to actually make this work in your own setting, as there are a number of things that need to be done in order to get this operationalized. Okay, so let's start off with a review of the Data Quality Toolkit and what this actually includes. So the data quality toolkit is comprising of several different materials that allow you to review the data quality functionality within DHIS2. So we have a document that's on our documentation page, and I'll open that up in a second just to review it real quick. That basically covers everything that I'm going to discuss in this webinar, but in quite significant detail. It discusses how you configure these various metrics, how you work with these tools, how you interpret the analyses that is shown from these tools. It's quite a comprehensive document. We are looking at creating some summary documents of this as well to complement what exists. We also have a demo instance where everything that I'm showing you today is set up. This will allow you to try it on your own time if you want to see some of the outputs and maybe think about how you can apply it to your own system. We have a number of different tools as well. We have an app that's set up for the annual data quality review. So if you were previously working with the WHO data quality tool, then this is an app that replaces the function of the annual report that was in that WHO data quality tool. There is I'll discuss a little bit what's happened to that WHO data quality tool and our procedures going forward, essentially as well. And we also have set up a tool for monitoring your data quality progress. So this will help you to identify if you're actually fixing these data quality issues over time. I'll discuss this a little bit more towards the end of the session. We then have a bunch of implementation guidance in addition to this. So we include an SOP template that you could fill in or just to give you an idea of where to get started. I'll discuss that later on as well. And we have a number of checklists that go over kind of, what you should think about or consider, what you need to get started in order to move this forward. And this is more to do with the implementation and less with the configuration and interpretation of the metrics that we're going to discuss. So everything that we've incorporated in our data quality toolkit is heavily based off the WHO data quality framework. And there's a number of guiding documents that WHO provides to its member states and to anybody else who's interested, basically, as it's publicly available, to kind of assess data quality. And we've tried to follow a number of these steps in order to kind of engage with data quality this way. So at the moment, we're focusing on aggregate data. However, we are looking at tracker data in the future. It's just not something we have developed as in as much detail as we have for our aggregate data. And Global Fund, I would just like to thank them because they have really supported the development of this toolkit and given us a lot of support over the last couple of years in order to engage with various stakeholders, in order to kind of create all the documentation and all our training material and everything else that we'll be talking about today. Oh, so yeah, I just wanted to pull up the document real quick just to go over it. So this is the toolkit documentation. The presentation will be shared after the webinar, so all the links that I'm sharing will be available here. We have a lot of detail about all the different kind of types of analyses that we perform, and you can see there's all kind of screenshots in DHIS2. It shows you how to create them, it shows you how to manage them, how to interpret them, etc. It's a very detailed document, and we are looking at, like I said, summarizing some of this as it is quite long at the moment. But it can be useful in terms of understanding each of the different metrics in significant detail, as well as how to set them up inside of DHIS2 and subsequently interpret them as well. And there's different sections here on the left side here, just some background, and then the preventative measures, basically the analysis. We also have some separate information on things like denominators and the implementation side of things as well. Okay. So that's this first link here. You can see these underlined examples. These are links. So when you get the presentation, you can always open these up and have a further look. So yeah, these are the WHO data quality guidelines that I spoke of. So they have 4 modules that we're using here. The first module is it's covered here. You can't really see the text, but it's the framework and metrics. So it kind of outlines kind of for different programs, recommendations around different indicators or variables that are good to monitor as proxies for data quality. So kind of borrowing from this framework, one thing we do suggest is that basically you look at a subset of data within your system to assess the quality. And if you're kind of finding significant issues or significant problems based on that subset, you start investigating more broadly. But the idea is that you kind of limit yourself initially, otherwise it becomes too overwhelming. And that's a similar principle within this WHO data quality guidelines. So there's 2 modules here that we follow quite closely. Module 2 is discussing basically data quality review, desk review. So this is when you have the data and you want to review it, what are some of the procedures and steps that you can follow. And that's what we'll be covering basically in today's webinar, kind of closely following the second module. We have the third module here, which is the site assessment and data verification. This is basically supervision, where you go to the facility and you verify your data. Now, we won't be talking about that today, but we will have a webinar scheduled in January where we will discuss this in a lot more detail as we've developed a number of tools to assist you in that supervisory process. And then this last module here is the community health data guidance. This is fairly new compared to the other guidance, and we've incorporated this as well. If you look at basically module 2 and 3, you can perform similar types of analyses in the community with your community health data. So like I said, today we'll focus on module 2, which is the discrete assessment of data using desk review procedures. And we'll look at the other modules later on in other webinars. So in terms of the data quality metrics that we have in DHIS2, where it says new, I just want to highlight they're new to DHIS2. They're not necessarily new to the broader kind of context of looking at public health information or your information inside of DHIS2. So we have a number of metrics that have been inside of DHIS2 for quite some time, but there has been some deficiencies identified with those, some challenges with those. And that's why we have supplemented what we have in order to try and address some of those gaps. And we're going to go over each of these metrics in this session today and outline how we can look at them further. So we have dataset reporting completeness and timeliness, and I'll explain each of these measures in more detail so we're all on the same page here and give examples inside of DHIS2 as well. We have some new ones, once again, new to DHIS2, not necessarily new overall. Data element completeness, facilities and consistently reporting. These are two of our new ones we've added to DHIS2. We have outlier analyses as well. And while that has been around for some time, we have added some kind of new ways to look at it, which makes it a little easier to investigate and find out the scope of the problem. And then we have some related measurements for outliers as well that are new. Denominator comparisons. And once again, obviously that's been around for some time. And we have this metric for a data quality index, which is basically a composite score of your data quality. We're not going to touch on this one today, but we will go through the other ones that I've outlined here. So as I mentioned, we've basically broken down how we look at data quality into these 4 steps or 4 kind of processes, right? So on the first side, we have prevention, right? And this is where we look at kind of at the design of our data collection tools and basically trying to prevent as much poor data from being saved in the system before it's reviewed. And hopefully this saves some time. So this is basically during the data entry process. So we have things like validation rules, minimum and maximum thresholds for aggregate data. And then for tracker, while we won't be focusing on it too much today, we do have program rules that basically can serve a very similar function as validation rules does for aggregate data, but this time for your case-based data, whatever it might be. Okay. Then the second box here, we have the identification. So this is when you have all your data in the system already and you want to review it. You want to identify what's wrong. And we'll spend quite a bit of time discussing some of the metrics and how they work inside of DHIS2 so you can identify your own data quality problems. So we have a lot of different analyses tools. We also have the supervision tool, which I won't get into too much today, but it's another way of identifying some of your data quality issues and challenges. We then have at some point in time, after you've identified these problems, you need to figure out, well, how will you fix them? And then we also have some tools to help you monitor these fixes. So over time, are you actually addressing the data quality issues that you've outlined or identified? Okay. So we'll be kind of heavily focusing on these 2 points here, but we will also discuss the other ones to some extent. Okay, so we'll start off with the prevention. So for the prevention, it kind of starts with the tools that you're using to collect your data. So while we're not discussing this so much right now, generally speaking, how your data sets are designed to collect this data, how they're structured, it can be quite important in terms of getting in quality data. And you might not necessarily associate the configuration with data quality, but there is quite a strong linkage between these two. So, we've listed some points here to consider. There's some more. These are outlined in our guidance, but just to give you some idea in terms of what are some kind of good practices to think about when you're kind of configuring or creating your data collection tools and reviewing them and setting them up inside of DHIS2. So the first one, pretty self-explanatory. It's just ensuring that the data collection forms are understandable and easy to use. And, when you think about this, you probably don't want a lot of scrolling, let's say, horizontally. You don't want headings that are hard to follow. So if you scroll vertically and you can't see the boxes at the top, people don't know where they're entering data. So simple things like that can actually just help with the design overall. Avoiding capturing data that can be calculated. So for example, if you can get a row total or a column total, then maybe you can automatically calculate that based on the data that's entered. I know there is some methods to triangulate as well, and that's why you in some cases want it separately, but in the case that you can get away with it, it can be helpful. Ensure that the data elements are configured with the appropriate value types. So for example, if a value should not be negative, maybe the data element should not accept a negative value. Setting up validation rules and configuring min-max thresholds when possible as well. And we'll discuss some of these further. Okay, so the first one we'll touch on is validation rules. And just to explain this, for some of you, this might be a review, but validation rules, they consist of a left side, an operator, and a right side. So basically, this is a metric of mainly internal consistency, though you can also use it for external consistency as well. So comparing your data in DHIS2 with data with an outside source. But let's say for the purposes of our example, we're using it as a metric of internal consistency where we're comparing two data elements, let's say in the same data set in our example, to see if the value lies within an expected relationship that we have with these two different variables, essentially. Okay, so in my example here, I have positive malaria cases should be less than or equal to the malaria tests that are performed. This is because the positive malaria cases is a subset of the malaria test performed, right? So just logically speaking, this should always be true, right? And that's how we define our validation rules, that, we're defining a relationship that it always should be the case. It shouldn't be something that's sometimes the case, or if you're looking at a certain period, it might not be true during that period. So a good example of this is maybe looking at the relationship between ANC1 and ANC4. For a particular month, you could have higher ANC4 visits if your data is collected monthly compared to ANC1 visits. So that might not be something you should look at every month, but maybe over a period of time, let's say 1 year, then yes, maybe ANC4 should be lower than ANC1. So you just have to be careful when you define these and how people are reviewing them. There should be some clear guidance, of course, associated with the review of these and how these are set up. Okay, so yeah. And yeah, just quickly, this is how it looks in DHIS2. I'll jump over to DHIS2 just to show this. But we have the new data entry app in terms of how validation rules are viewed, as well as the previous data entry app as well. So, okay, so this is the previous data entry app, and I'm just in a data set. So just as kind of maybe most of you are probably familiar with this app if you've been using DHIS2. Here I can run the validation rules, or if I click on complete at the bottom here, it's already completed, but yeah, it'll then pull up any validation rule violations that I see. So here you can see there's a couple here. And what I can do is fix one issue on one of the sides here. So remember, we have the left side, we have the operator, we have the right side. If I can fix the issue here at the source, then I can remove this violation. So in here it says MR doses given and wastage should be less than or equal to the doses available. So it's comparing the stock for MR here with the number of doses given, right? So if I can fix this, let's say to an appropriate value, I can run it again. You can see that the rule is no longer present. So the whole idea with this prevention is to prompt people, tell them what's wrong, and then have people fix it at the source if possible. We know it's not always the case where it's possible, but where it is, then that should be updated and fixed if possible. Okay. So this is how it looks like in the previous data entry app. We do have a new data entry app. It looks like this, and I just wanted to run it so you can see how it looks. So this is no longer in beta or anything like that. We do have some guidance on moving over from the old app to the new one. But in any case, this is how validation rules look like in the data entry app when in the new data entry app. So you can see it looks quite different. It gives you a priority, but it does also list the validation rule and what happened here. So here we see the number of contacts should be less than or equal to the number of people who receive breastfeeding counseling. So I could fix this, for example. And the thing with this, it tells you when the data has changed. You'll see here, there's a prompt here. So note this, it keeps kind of a live summary. You could run it again. In this case, it's now fixed. And that's how this works in the new app. So it looks a little bit different. It gives you a little bit more prompts, a little bit more information than previously within the old app. So it can be quite useful for those of you thinking about moving to the new app, just to let you know how it looks like. Now, it's one thing, sorry, right? So it's one thing that I run these one at a time when the data is submitted. But let's say it does, sneak past the person entering data, because for the most part, you can still submit the data set, even though there's some validation rule violation. Maybe they don't have the ability to change the data, or they don't have access to the raw data at the time when they're entering the form. They just have their tally sheet and they've entered what's there, and therefore they cannot change it. So we can also run all of these validation rules in bulk, and do an analysis for several time periods, several organization units together in order to see the violations as well. So we do this in our validation rule analysis. This is accessible in our data quality module here. So from here, I can access this validation rule analysis. So here I can select my organization unit, I can select the periods, and then I group my validation rules together. So this is not necessarily done by data set, though you can always group all your validation rules together in a group for a particular data set, and that's often done. So that's a possible method in order to do that. Okay, but let's just say in this example, I've selected for one, in this case, one province in my example here. And then I have selected several months. I've selected from August until the end of October. I have a validation rule group. And I can also send a notification. What this means is that when I detect a violation, I can send an email or even an SMS message to somebody to check this. So, maybe if somebody's not logging into DHIS2 all the time and they need to be made aware of these issues, then that can be done outside the system. Now, I'm running it manually right now, but this can be scheduled to run on an automatic basis. So let's say you run this, I don't know, 20 days into the next month after your data is submitted for the previous month. You can do that. It'll run the validation rule analysis and it'll send out the notification automatically to anybody who's supposed to receive that. So for now, I'll just run it manually. So I get some results. You can see here how it looks like. I have some information on the validation rule, the violation. I can check the details by clicking on this information icon. It pulls up the details for me and lets me review these validation rules. Just real quick here. Okay, so min-max is another kind of preventative method that we have for kind of working with the data. What this allows us to do is define a minimum and maximum value for basically every input that we enter into all our data sets. So we set this for every data element, for every disaggregation, for every organization unit in our system. So let me just jump back here and close one of these, and I'll just open one of these boxes. Okay, so this is the new data entry app here that I'm in. Here we have this min-max adding limits kind of thing where we can define the limits. Now, this is based on your user authority, of course. So here I can define a minimum and a maximum value for this particular value in this particular organization unit. and it will stick across for, whichever, periods I have, etc. Now, of course, I don't want to do this manually for, however many hundreds or thousands of organization units and variables that I have in my system. So you can imagine, here I have this disaggregated. I would have to set a minimum and maximum limit for basically every box, every disaggregation that I have in this form. Now, that is not practical. So there are ways to generate the minimum and maximum values for this. So just to show you how it works, right? If I set a minimum and maximum value, save this, okay, and then I enter something above this, okay, it'll give me some information here to say that the number, cannot be outside of this range. And that's how this works inside of DHIS2. You can also run a bulk analysis on this as well. So obviously this is a bit cumbersome to do. You're not going to want to do this through data entry for the most part for every variable. But we do have some tools, and I'll discuss those later on, that actually help you to generate all of this. So you can use some tools basically to generate all the minimum and maximum limits and put them inside of DHIS2 for all of your data. We use some very statistical measurements, metrics in order to generate all of that information. Okay, so I won't be focusing on Tracker too much, but just so you're aware, we do have some functionality here that works very similar, basically, to validation rules, but for individual data. And this is called program rules. This allows you to check the consistency of the data that you've entered. So for numbers, is it within a certain range? For any of your dropdowns or any of your selections, does it follow a specific pattern that you're supposed to have? For any text or ID numbers or anything like that as well, you can check, like a phone number, or if it's an ID, national ID, and it's supposed to follow a specific sequence, you're able to check all that stuff as well. So at the kind of case-based tracker level, we do have some tools that assist you with assessing the quality at the point of entry. I won't be going over them too much, but just wanted to mention that they are available, and it's something that can be set up in order to help you there as well. And there's some resources here on these various topics. And once again, these slides will be shared, so you will have access to all of those. Okay, so next I wanted to discuss the identification side. And there's quite a bit here to discuss because I'll be introducing several of the metrics that we use in order to kind of identify some of the data quality issues that we have. So the way that this works, we have some built-in tools inside of DHIS2, and basically they'll work without too much extra configuration. You need to define the inputs, what do you actually want to look at, but it's kind of easy to set up, right? Or easy to make them. Then we have some tools that require extra configuration. So if you're kind of looking or searching for these features in your own system, just keep in mind as I'm going through this demonstration and discussing this, that there is some configuration, extra configuration required in order to make that happen. So kind of features that work kind of immediately without kind of too much extra effort. Validation rule analysis. So that's what I just showed with the various validation rules in data entry and the validation rule analysis that's present. You need to define the relationships that you're looking at, which variables are you looking at, and what should the relationship between those two variables be. But once that's set up, you can run the analysis or look at this in data entry as well. We also have outlier analysis, which looks at outliers. I'll explain this more and I'll run it to show you. And we also have a new feature called outlier tables. Once again, I'll explain that further. And then we have things like dataset completeness and dataset timeliness as well that have been around for some time. But there are some challenges with these metrics that I'll identify as we go through the session. Okay, so some of the stuff that requires the extra configuration that I'll go through now. We have a data quality dashboard, and we're really emphasizing the use of or the routine kind of verification of your data quality rather than looking at things, let's say, on an annual basis or a semi-annual basis. If your data is collected weekly, we want you to look at it weekly. If it's collected monthly, same thing, looking at the data monthly. So depending on the frequency of your data collection, we want you to basically look at your data as much as possible. And then we have some additional metrics that I'll define: data element completeness, facilities consistently reporting, some other metrics around outliers, denominator comparisons, and then some of our monitoring tools and the WHO Data Quality Annual Report. So these kind of features require some extra configuration. They won't just be present in your DHIS2 system. Okay. All right, so let's start with the dashboard. So because I'll be referring to this dashboard quite a bit as we go through our various sessions. And this dashboard is available in our demo instance as well for you to review if you want to have a look at that. So the dashboard includes the various key metrics that we're going to discuss here, looking at completeness, consistency, outliers. And there's a separate dashboard for denominators as well. It's designed to be used at various levels of the system. So the whole idea is that you can reuse the dashboard depending on which view of the system people have. So, maybe people are accessing national org units at the, national level. They've seen the whole country. Or maybe if you're working in a province or a particular district, you only have access to a subset of information, but you can reuse the dashboard depending on which view you have. So right now, the demo dashboard uses several of the core indicators from the WHO Data Quality Toolkit, but you can have program-specific dashboards made as well. So let's say you want a malaria-specific dashboard and you're looking at 8 or 10 specific indicators as a proxy for data quality. For malaria, you can do that as well. And we'll discuss that as we go through the demonstration. Okay. So let's just go to the dashboard real quick. Okay, so this is the dashboard in DHIS2, and what we've done basically is try to incorporate several of the metrics, and I'm going to discuss these metrics in much more detail now as we go through each one. But the whole idea, and what I wanted to emphasize as I go through this, is that the dashboard is set up in such a way that it's meant for you to kind of quite quickly be able to investigate the underlying problem. So let's say we have here, if I go down, maybe we have some issue with our outliers, and we want to find out which facility this is coming from, right? Then we can quickly do that. We can quickly drill down and find out which facility is the source of that problem. I'll discuss that more when I discuss outliers specifically, but that's how the dashboard is set up. So the whole idea is if you look at this, in this case, I'm looking at monthly data that is submitted monthly, and everything looks okay. Then I can kind of go on with my day and I don't have to kind of spend too much time worrying about any of these outputs. But if I'm identifying problems, then I want to make it kind of easy to find out the root cause of the problem, right? So you can call the facility or assign somebody to do a supervisory visit or, whatever it might be, whatever is outlined in your procedure in order to fix that data quality problem. So we don't want to make it too cumbersome on anybody, to take on this responsibility. At the same time, a little work is needed to review the dashboards every month or every week in the case that you're getting your data weekly. But the whole idea is really to make this as easy as possible to identify the issue first and then investigate where that actual problem is coming from. Okay? So we'll use this dashboard to demonstrate all of the different metrics that I'll discuss. Okay, so the first metric that I'll discuss is dataset completeness and timeliness. And this has been the kind of traditional way of assessing completeness inside of DHIS2, right? So when I look at dataset completeness, that just means, has a dataset been submitted? And if I have, so many datasets or so many, reporting units, then, based on this, I can calculate a percentage, the number of datasets submitted divided by the number of reporting units that are supposed to submit that data set, and I can get a percentage. And we also have this measure of data set timeliness, which is reports that are received on time. And this is a user-defined function, and I'll discuss that. I'll show where that's defined. And this is divided by the number of expected reports that I receive. So, well, this has been the traditional method of kind of looking at completeness and timeliness. There are some challenges here, right? And let me discuss this just as I go through an example. So, basically how this completeness, first let's talk about completeness, is calculated. When I go to the bottom here, either in this is the previous data entry app, and I select this complete button, then this data, even though there's a validation rule violation, we'll ignore that for now, okay? Then this data set is considered complete for this organization unit for this period, okay? And that's how the completeness gets calculated compared to the number of expected reports that are received. This is the new data entry app. I can mark it as complete. And you can see here it's now completed. Okay, same type of thing. When I mark it as complete, then it's considered as complete for the entire data set. Now, the issue that has arisen from this particular metric is that you can see that a number of the variables don't have data. So in cases where you need specific variables to have information, while the data set is complete, you don't actually know how complete your data is. And that's kind of the issue that has arisen from this particular metric of having the data set completeness, where you're just kind of saying as a blanket whole for my entire data set, this is how many data sets are submitted versus how much I expect. And that percentage could be quite high. But within those data sets, you have a lot of missing data, which doesn't allow you to make appropriate kind of assumptions when you're going to review your information and make some type of planning or policy decision, as the information is not complete enough and you're missing a lot of data that actually would contribute to that specific indicator that you're reviewing. So in terms of timeliness, because timeliness is also defined within this, this is a user-defined function, okay? And when you're making your data set, you define, what is the timeliness for your data set. So in this case, for this particular data set, it's defined as 15 days and it's a monthly data set. This means on the data set has to be marked as complete by the 15th of the next month in order for it to be considered timely, okay? So you can change this value, right? This is just defined when you make the data set, or whoever is working with you makes that data set, you would tell them what it is. And that's how you define timeliness in DHIS2. If it's marked complete within the time period, that qualifies it to be a timely submission. Okay. Now, as I mentioned, there are some challenges around these metrics. So we are looking at kind of different ways to incorporate different metrics as well. And one of the kind of newer metrics to DHIS2 is data element completeness. So instead of looking at the completeness of an entire data set, we are now looking at the completeness of the actual variables themselves. So whether or not the individual variables that we identify have data. So the way we calculate this is the number of received values for a particular variable divided by the number of expected values for that particular variable. Okay. So if I just go over back to DHIS2 here, okay, and I'll just focus on one of these here. So this is a chart we've created for data element completeness, and I'll open that up. Okay, so what we're doing is we're looking here at 4 different variables, ANC1, DPT3, malaria confirmed cases, and PLHIV new on ART. And then we also have separated this out, in this case by organization unit group, district hospitals, and primary health centers. Okay, so the type of facility that has submitted this data. Okay, so just let me zoom in on some of these here. So let me take DPT3 less than 1, and let's have a look at it. Okay, so what we're calculating in this instance is the data element completeness for this specific variable. So what we're saying here is for primary health centers, for this month, in this case, it's October 2025, I have a data element completeness of 84%. So this means that the data is 84% complete for this particular variable, okay? Now the data set that this belongs to, maybe it's an immunization data set, for example, it could have a higher completeness rate than what we see here compared to the actual completeness for this particular variable. So we see this kind of reflected more problematically in the malaria data, where we're getting these low values, right, of 50% and 56% respectively for district hospitals and primary health centers. Okay. So what we're seeing here is that, if I highlight this one where we have a value of only 50% or 51% if I round up, only 51% of the data sets that have been submitted have a value for malaria confirmed cases for the different primary health centers that are available, okay? Based on the expected reports that I have. So this is quite low, and this would be, it would warrant investigation, right? So we need a way to kind of identify this or more kind of easily determine this. So I'll just sorry. So all I've done here is basically make a pivot table for the previous month. In this case, it's for ANC first visit. We could also look at malaria confirmed cases. But here, if I sort this, so everything has a value. So maybe I want to take this and look at that malaria confirmed cases value instead, right? So in this case, when I see every location, because there's no blanks, this means that every facility has submitted a value for ANC1, okay? And so for this month, we should have, 100% completeness essentially, because every facility has submitted a value, right? Now, what happens in the case that we mentioned earlier, okay? So what happens in the case that we mentioned earlier is when you have facilities that don't report a value. So here I see all the facilities that reported a value, right? And I'll just arrange this again. And now we have a lot of blanks, right? So here we see facilities that didn't submit a value, right? And this is contributing to that completeness that is low, right? Where we only saw 50% for primary health centers and 58% for the district hospitals or something like that, right? So that this was pretty low, and this is because facilities are not submitting a value. So they have to submit a value in order for this to be marked as complete. So now we're looking at a specific variable, and we can look at many variables, of course. You don't have to just look at one. But just to kind of highlight the concept, we are looking at this one. And we would basically want to investigate whether or not, these facilities should be submitting a value or not. So in order to determine that, we actually have a complementary measurement that allows us to check. Because one thing we don't want to do, if there's not a lot of data submitted, it doesn't necessarily mean that it's worth following up with every single facility, right? That could take a long time depending on where you're working. Even if you're in district, you might have 10, 12, 15 facilities. It could be cumbersome to follow up with all those facilities, especially if you don't need to. So we have a complementary metric to data element completeness. And this is called facilities consistently reporting. And this will help us outline a trend within our facilities to determine for a particular period of time if we think a facility should be reporting data or if it's kind of okay that they're not. And maybe some other adjustments need to be made when we're reviewing our information. Okay, so the way facilities consistently reporting works, it looks at the number of facilities that have consistently reported data. So how we define this is basically, in our case, we can define it in different ways, but let's say we say that a consistently reporting facility is a facility that reports a value every month for the last 12 months, okay? So what this means is that, now we're in November, right? So we could look at, maybe October of last year until October of this year, since it's still November isn't over. And we look at that 12-month period and determine, has that facility submitted a value every month? Okay, from October 2024 to October 2025. And if so, it would be marked as a consistently reporting facility. Okay, so to further demonstrate this issue, we'll go back to DHIS2. Okay, and now we have, we're looking at the trends over the last 12 months. Okay, and basically, so if I just take this first facility here, okay, we can see that it has submitted a value for every month over the last 12 months. Okay, right? So this will be marked as a consistently reporting facility because it has a value for every month for the period that I'm reviewing. But if I look at the one below, we can see that it's missing values for September and October. Now, this would not be marked as a consistently reporting facility because it's missing data for 2 months. So this can help us identify kind of the trend, the broader trend of facilities that are reporting information. And we can similarly summarize these. I go back to my dashboard here, as metrics. Okay, where we're kind of calculating the number of facilities that are reporting on this variable divided by the number of facilities that are kind of expected to report on this variable over that same period, and we're able to get a percentage. Okay, and this once again is complementary to our data element completeness, as it can help us identify a kind of a trend over time, whether or not we think these facilities should be reporting, and if so, then whether or not it warrants investigation to check on some of these facilities. So if we kind of bring these two concepts together and go back to this visualization, so you can see here, let's just arrange by October again, we were looking at data element completeness for October, okay? And I'm zooming in a little too much. Okay. And then we see some facilities that haven't reported data. Now, if I look at some of these facilities and the broader trend, like this one here, it reports very infrequently. Okay. So the likelihood of us needing to follow, and the values are low. Okay. So the likelihood of us needing to follow up with this facility, it's pretty low, right? It's probably not something that needs to be done. You might want to prioritize, for example, this facility. You're getting reports all the way up until September. Then for some reason they stop reporting, but they're reporting quite a bit of cases up until that point. So, why they haven't submitted cases, that's up for debate. You might have to contact them and figure out what's going on. But this is how we can kind of prioritize which facilities we review and which ones we don't. We look at the longer term trend and we check, kind of the kind of weighting of the data are they submitting a lot of data? Are they not submitting a lot of data? And this can help us to determine which facilities we should follow up with on a routine basis, right? And we really only want to target those ones that are very problematic, that aren't reporting data for some reason or the other when we think they should be reporting data, okay? To help us kind of with our completeness. And the whole idea behind this, right, is when I look at these indicators. So if I had ANC1 in my previous example, the completeness is very high. If I look at this one where I'm looking at malaria confirmed cases where the completeness is low, when I start to create indicators and start to make assumptions then about the services that I've delivered or the progress of my programs, I'm not able to do that with a lot of confidence if I'm missing a lot of data, essentially, right? And that's the whole idea behind doing this is to try to review this information and where you can identify these gaps. Okay, so these two metrics are very complementary to one another. Data element completeness and facilities consistently reporting. They're looking at specific variables that you capture rather than looking at an entire data set. And the reason we look at this is to kind of make sure that we can firstly identify the problems that we're seeing, But secondly, we can, if we are able to fix this over time, then when we start looking at metrics related to these, whether they be indicators or other types of outputs, um, that those that we're making assumptions and reviewing our information with sufficient data in hand to make an appropriate conclusion. Okay. Okay, so we have a number of other metrics that are also present. So consistency of related data. This is looking at basically the relationship between two variables and where we think there should be an established pattern. So something like validation rules actually also falls into this category of consistency of related data. We are comparing two variables. We have an expected relationship between these two variables. And if the data is outside of that relationship, then it might warrant some investigation. Now, there is some specific analysis that we can perform on these related variables in addition to validation rules, however, um, that allow us to, gain a little bit more insight as to what's going on. One particular one I have on screen here, and I'll demonstrate it further, is a scatter plot. We take two related variables, ANC1, ANC4, DPT1, DPT3, these kind of variables that have a relationship of some kind, and we analyze the difference in these variables. And when we identify if there's a significant difference in between the expected relationship, we kind of want to check if something is wrong on one side versus the other. So an example of some of these, if I just scroll down a bit, something like a dropout rate as an example. So this is looking at DPT1 to DPT3 dropout rate. Um, and basically the relationship of this should be over a significant period of time. DPT1 is generally greater than DPT3. You don't want to look at this in a singular month because that might not be the case. But over, let's say, a year, then it should be the case. Now, when you have a negative dropout rate, this means the amount of DPT3 doses administered is greater than the number of DPT1 doses administered in this particular organization unit, which, generally speaking, is not really correct. So that's one way to identify some information between this related data is using these dropout rates. But not every variable, of course, does it make sense to have these types of dropout rates. We also have, and I will just have to zoom out a little bit here to make this make sense. We also have something called a scatter plot, which analyzes this relationship. Here I'm looking at ANC1 and ANC4. And this allows us to perform a bit of analysis here to determine, what's going on with the relationship between these variables. And what I'm seeing here basically is a lot of the values are kind of tightly bound together, right? Because the expected relationship is such that they might be close, not necessarily in value, but the relationship or difference between the two, is pretty steady over time. But what we're seeing, and I can scroll over each dot. So if I scroll over one of these dots, right? So it's not showing me that these values are equal, but basically that we have an expected difference between the two based on a statistical method that we kind of expect would be the relationship between these two variables. But if it significantly exceeds that, so if I go up to one of these red dots that's way out in the middle of nowhere, we can see why it's highlighted, right? ANC first visits is 25,000 and ANC fourth is only 427, right? So it doesn't tell you the nature of the relationship or which way the relationship should go, but just, understanding the data a little bit, we can probably see from here that, there's something wrong with ANC fourth visit. It's really low in comparison to the ANC first visit, right? Probably doesn't make sense because this is in the same health facility. Unless those mothers are going completely to a completely different place, it doesn't really make a whole lot of sense that this would be happening. And this is for the entire year. Now we're into November, so we would have the data at least until October at this point. So it's for a significant period of time. And it doesn't really make sense. So we want to investigate that further. Okay, just while I'm going to have a look at the chat and I see there's some activity there. Just while I'm doing that, just to make sure you're all paying attention. So I'm just launching a quick little quiz for you, just with 2 questions, just on some of the content here. I'm just going to look at the chat here and see if there's any questions or anything I should address while you're filling that out. The quiz should just pop up on your screen and you can fill that out real quick. Okay, so I might just try and address 1 or 2 questions while we take this little mini break. Okay, yep. So questions about sharing the presentation, absolutely. We'll share the presentation, the recordings, everything directly after this webinar. Okay. For sending an email, yes. So some Hara asked about sending an email or SMS. Yes, you do need a configuration. So for sending out an email, you need to set up an email server on your instance, or for sending an SMS, you need something called a SMS gateway. This will allow you to send the information from your DHIS2 instance to wherever it's located. Let me see here. Let me just I can should have received the email just so you can see I didn't get a chance to do that. Yeah. So this is how the email looks like. I didn't get to do that while I was making the presentation, but this is how the email looks like. It groups the various validation rule violations together, and you can get a sense of what's actually the problem. So this is very useful, of course, if you're not logging in to DHIS2 or if someone's not logging in regularly. They are able to still see this in their inbox. Okay. And then maybe I'll take on 1 or 2 more questions here. Is there a tracker program? Okay, so yeah, what I want to kind of emphasize is that all these metrics and measurements are configurable by you. So I'm using a mix of different measurements here, ANC1, malaria, HIV, TB, and I've configured those. Okay, so if I look at my dashboard, I have too many windows open again. So if I just go back to DHIS2. So here I have several metrics configured, ANC1, DPT3 from immunization, malaria, PLHIV, okay? I can add more, right? Or I can look at a specific program, right? If I just go here, I have one specifically for immunization, for example. Okay, so this is a dashboard for immunization where I'm looking at some of the same metrics, but only for the immunization program. And now I have a lot more immunization data elements that I'm reviewing, right? I'm not just looking at 1 or 2, I'm looking at several. So, when I configure these dashboards, it's up to me to decide what do I want to review, and I can review based on that. So there's no app or anything. This is all built into DHIS2. So I use the regular DHIS2 configuration in order to configure that and make that happen. I don't have to use any external tools. But in terms of defining what you want to review, that's 100% up to you. The WHO Data Quality Assurance Guidelines has a number of useful kind of guidelines to get you started and give you some input as to what you might want to look at. But if you have a good idea of what that is, for example, for a TB program or leprosy program in your case, you can select those specific variables, those specific pieces of information, and set that up. Then you asked a second question here about 0 cases. So it really depends on your DHIS2 configuration, right? So whether or not your variables are storing zeros will determine what you do here, right? If you're not storing zeros, then you see a blank and someone entered a 0, that 0 won't be saved, right? So the blank will be treated as having no value. So if you need to save zeros for some reason, I think there are certain cases, of course, where it's warranted, particularly for some type of surveillance data, for example. Of course, this is a contentious opinion, but in that case, you might want to save the 0, right? But if you're not saving the 0, which we recommend in many cases for a variety of reasons, then the blank will be treated the same as a 0 because the 0 won't be saved. So you just have to make that differentiation and make it very clear to anyone who's interpreting your information. When they see a blank and you're not storing zeros, then that zero is not being stored. So if I'm looking at something like data element completeness, for example, then I won't see any information associated with my data element. Okay, so there's quite a few other questions. I'll jump back to those in a moment. Okay, and I'll just let that, I'll just keep that quiz up while I'm running things. Okay, and let's go back to the presentation here. Sorry, I just need to find. Okay, here we go. Okay, so let's look at a couple more metrics here. Consistency over time is another way to look at data. And this one really helps us identify very obvious initial outliers in our data set. So we're kind of moving on to discuss outliers a little bit more. And just let me go back into DHIS2. So be very good representations of this on the dashboard. I'll go back to my original dashboard that I was on. Okay, so this is an example of a consistency over time graph. And what I'm showing here, I have ANC1 monthly, the ANC1 value for the last 5 years. So each line represents a year. So if I scroll over here at the bottom, just highlight one of these lines. So this green line is the value for ANC1 for 2025. And the x-axis here, the bottom axis, are my months. The y-axis, the vertical axis, these are my values. And then each of the lines represents 1 year worth of data. So if I compare this, and I see here for 2025, some very high spikes, some very highly elevated values. And then if I compare it, let's say to 2024, I see it's a lot higher than the previous value, and I see some quite obvious spikes in my data. So, without any training or with very limited training, maybe I should say, it's very easy to kind of identify obvious problems with the information. Now I need to investigate this further. I need to find out, for this particular period, so June 2025, I have this value of 75,000, whereas previous years I have 41, 33. This is quite a bit higher, right? Does that make sense? Is this an acceptable value? When I look at my ANC1 coverage, it's going to be quite high for this particular month and even for the year because I have this potential outlier present in my data. Then I would really want to check what's going on. Okay. So this is kind of a very nice visualization in terms of you detecting obvious outliers. Maybe someone entered too many zeros when they were doing data entry, or they just made a data entry mistake. So all these kind of consistency over time charts represent very similar type of analysis. And you can see that for some of these variables, like if I look at malaria confirmed cases, there's not really any significant variation from year to year. It's pretty tightly packed. There's not anything that really stands out from here. That doesn't mean there's not any problem or not. We have to check that further. But at least here for ANC1, you do see this kind of obvious spike here and here when compared to the previous months when looking over various years. So this can be quite useful to look at as well, as it helps us identify really quickly some of the problems that we're seeing. Okay, so outliers is another way we can look at challenges with our data. So what an outlier is, it's data that is significantly different from previous historical values. Okay, so if I'm looking at my information and I'm comparing it to previous data that I've entered, or that's in my system, then there should not be a significant difference between the two. It doesn't mean the values can't be different. They just should be within a kind of an expected range, at least statistically speaking. So we use statistical relationships in order to identify these outliers, basically. and assign weight, to whether or not these are significant and impact our data. So one thing, originally we were speaking about completeness, right? Do we have enough data to review our output and make a final assumption, make a conclusion about our program's performance or service delivery, okay? The second part of this is, well, is the data that I do have, is it valid or not, right? Because then if I start making assumptions based off indicator values that are highly inflated or much too low, maybe it's because that the data that I have on hand, some of it is not valid. It's an outlier that values are either too low or values are too high, and they should be kind of checked and fixed where possible. So there's a lot of kind of analysis related to outliers that is relevant and can be useful. But I'll just go back to the dashboard here. And I just wanted to kind of walk through some of them, okay? So here we have a couple different outputs for outliers, right? This first percentage that we've calculated are the number of values that are outliers, okay? So let me just kind of walk through what this means, okay? So let me just highlight one of these, okay, here. So I have a district hospital, and it has a value where the number or the percentage of outliers are 2% roughly. So what does this mean? How do I actually kind of obtain this value? Okay, so as an example, okay, I have 45 facilities that report data. Okay, and out of these 45, one of them has reported an outlier. Okay, and then I take one, and that equals roughly 2.2%. Okay, so that's how we're getting this value. Now, the problem with this is it's telling me the percentage of outliers, which is pretty low, right, in this particular case, but it doesn't tell me the weight of the outlier, right? And the way it's identifying this outlier, once again, is based on a statistical kind of test to check. It's checking the current data that's entered for this facility and comparing it to previous data, okay? So based on what I'm seeing here, I just have maybe, one or two outliers for the district hospitals in November 2024, which isn't bad necessarily. It's not too high. But the problem is it doesn't tell me, is this affecting my data to a high degree or to a high extent, or does it not really affect my data too much? And then I don't need to worry about it. Okay. So let's look at this chart below, core variables excluding outliers, because this tells us a little bit more information about how the outlier is impacting our data, right? So let's just walk through this one real quick. Okay, so let's say for a facility, our total value is 100, okay, for ANC1. Okay, that's the reported value that's been entered or across all the organization units or reporting units that are reporting for this value, okay? But then we have an outlier of 25, okay? So, this value is not valid. It needs to be changed. The number of reports are pretty low, okay? So if we want to remove this outlier from our total, okay? So if we remove the outlier, our new total is 75, right? 100 minus 25 gives us 75 because we're removing that outlier because it's not valid from our total because it's having an impact on this. What we want to do is calculate the weight of that outlier on our output. So basically, if I were to look at ANC1 coverage for that month and I included the outlier versus if I looked at ANC1 coverage for that month and I excluded the outlier, what would be the difference? Would it be significant? Is it contributing to a high weight? And is it because I have that outlier existing in my data that I have further challenges making an assumption or conclusion about the nature of kind of what happened with that information, right? So what I would do here, basically, I would take, okay, which is 75. I would exclude my outlier, okay? I would divide this by my total, I times it by 100%. And that equals something like 75%. Okay. So this percentage here is showing us the value excluding the outlier, the weighting of the outlier on our total. And the higher this is, the better you're off, basically, right? So if I look at this chart here, it has a percentages in red and different other colors, green, right? Green is good, right? Basically, the higher the percentage, the less impact our outlier is having on our total. The lower this percentage is, the more impact the outlier is having on our total overall value. So where we see this, for example, 40.85, meaning that the outlier is actually 60% of our data, okay, essentially. And if we remove that outlier from our data, we're only left with 40% of our total value. Even though if I look at this corresponding, because this one, this value here, right? This corresponds ANC1 values that are outliers. It says there's only 3% of our total data is an outlier, but it's a big outlier, okay, according to the value below, because it's contributing to 60% of our total. And if we remove that from our value, we're only left with 40% of our data. Okay, so it's important to understand the difference between the number of outliers that exist and the weight of those outliers when we perform this analysis. Of course, there's a lot more time we could spend discussing this, as there's a lot that can be done with outlier analysis. But the whole idea here is to identify, one, how many outliers do I have? Two, what is the impact of those outliers on my data? Okay, and then what we've tried to do is make it quite easy to investigate those outliers. So here we have a table where we basically just pulled out those outliers for you directly. So here, for example, I see this ANC1 outlier in this particular district. And what I wanted to emphasize is that, the reason we've done this is so it's easy for you to investigate these, right? I have this very high outlier for September. Okay, I can just open up the table and I can just start drilling down and I can find out exactly where this outlier is located. Right here, I have this health center, I have this very high outlier value. I would want to follow up with that facility, contact them, and just figure out what happened here. Based on the data that's entered, this is much too high a value. That's there, and I would want to correct this. As if I were to look at ANC1 coverage, either in this facility, this district, or even my country, my totals would be thrown off because of these very high outlier values. Okay, so we have a couple other concepts related to outliers that we can do. We have a built-in outlier analysis that allows you to run this outlier analysis in bulk, similar to validation rule analysis. This is a kind of automatic tool within DHIS2. Doesn't require any extra configuration. But you can check your outliers here, and this can be quite useful. Just run it real quick. Okay. And you do select, so we use these different statistical methods basically to identify the outlier. Here we can select from the z-score or the modified z-score. The z-score is using your mean, your average. The modified z-score is using what we call the median of your data, the midpoint of your data. And then we're defining the threshold. Okay, so we have more information on this in our documentation. Okay, so I'll just start this. And here it identifies outliers. So here's an example again of this kind of similar thing that we're doing before. Here I have the value that's been entered. Here's the data element. And then I have kind of the median, so the middle point of that data. So the middle point's only 2,000, but the value that's been entered is 9,000. So it's quite a bit higher, right? And it's making this comparison and telling us if this data is acceptable or not. Here we have another one. The value entered is 1,300. The median is only 11, right? So it's significantly higher than the midpoint of the data. And because of that, it's being identified as a potential outlier. And then I think the last thing I wanted to show related to outliers was our outlier table. So this is a new visualization in Data Visualizer. So, maybe the thing you've noticed with these analyses, whether it's validation rule analysis or outlier analysis, is you have to run them, right? You have to run them manually, or in the case of validation rule analysis, you can run it automatically and get the output, but it can be useful, for example, to display these outputs on the dashboard. So in this case, I have the outlier table. It's showing me the kind of very similar to what I would see in the outlier analysis, all the outputs here. And it's giving me the basic outputs to identify some outliers for me to review. Now, why, I had that table before above here, where I had pulled out specific outliers. This is very useful. As you saw, I was just able to open it up. I could quickly drill down and find the facility that was basically reporting this problematic value. But here I can also get a summary and same type of thing, right? Here's the value that's been reported. Here I'm looking at ANC first visits, but once again, I can select any variable here, right? It's up to me to define which specific variables I'm looking at, and I can use those in my analysis. So here I have ANC first visit for March 2025 in this particular, in this case, it's a health center. It could be a different reporting unit. My value is 23,000, but the midpoint of this data is only 217, right? And then we can see the score is really high. So because it's so much different than the midpoint of the data, this is why it's being identified as an outlier. Okay. And there are several methods we can use when I'm in this. I can define which type of outlier analyses I use and define the threshold and detection method. Once again, the different statistical method that I use to identify these outliers. Okay. So there's a lot of kind of pieces here related to outlier analysis that can be quite useful to help you identify these outliers. So this really helps you determine the validity of your data, right? Before we were looking at completeness, which tells us, do we have enough data? Do we have the data that we're supposed to? But now we're looking at the validity of the data. If we have, whether or not we have enough data, is the data that's entered actually making any sense, right? And if it's not, we should probably figure out some ways to fix it, right? We should contact these facilities, follow up with these locations, and implement some SOPs and enforce those SOPs in order to kind of rectify whatever challenges we've identified. Okay, another very useful kind of piece of information to review are denominators, right? And denominators, I think this type of analysis, it's been around for a long time. And kind of the whole baseline behind what we're doing here with denominators is comparing your denominators with denominators that have been calculated using some other type of methodology, right? For the same location, for the same age groups, the same genders or sexes, okay, over time. So we also have in DHIS2 a dashboard on denominators that goes through this example. Now there's a lot to talk about on denominators, and I won't be able to get through everything now. We have a whole section in our guidance dedicated to denominator analysis, and we have some supplementary materials that are available there. But like I said, the whole idea behind what we're doing here is basically making external comparisons where possible, but also internal comparisons. And I just wanted to highlight some of these. So here in this particular table, I have one column here separated for all my ages by 1 year, my census data, okay? And then next to it, I have my UN population projections. Okay, so this is taken from publicly available UN data. Okay, and I brought it into DHIS2. And what I'm doing is comparing the census projection with the UN estimate. Okay, and of course, these would have used two different methods to calculate the population. Okay, and then I'm comparing them and I'm saying, well, if they're not significantly different, then this gives me a little bit more confidence, or in this case, a lot more confidence, I would say, to say that the denominators I'm using in my indicator formula are valid, right? And if I can, explain this to partners, I can also, for my own kind of peace of mind, understand this. So generally speaking, you're looking for differences of more than 10%. And this could be in either direction, right? So if it's a negative value, it doesn't mean anything really. It just means one value is more than the other. But here you see some differences here, right? And generally speaking, you're trying to avoid these differences of more than 10%. But for the most part, this data is there's a lot of green here, meaning that they're pretty closely tied together. And that's very useful for me to understand because my census data is very similar to data that has been calculated in a completely different way using a completely different method by a completely different agency or organization. And when I have that, that's useful for me. Now, the flip side of this is when it's not the same, right? When you are seeing a lot of differences, then you might have some challenges. You might have to determine, which method it makes more sense. Why is your data so different than something else? When generally speaking, that should not be the case. You can also look at a number of other metrics or measurements. You can look at different rates. So things like crude birth rate, the infant mortality rate. You can compare these using your data, the data that you have, and compare this to an external source, right? In all cases here, I'm using this UN population projections, which I think is a good tool to have, good useful way to estimate things, as they provide a lot of different metrics and measurements that you can use in your analysis. But same type of thing, you're looking for differences of roughly 10%, and if not, then you might have to investigate a little bit further. Now, in these scenarios, this is using your data and comparing it to external data, but it could also be useful to compare data internally. So you might want to compare denominators from different programs, right? Let's say your immunization program uses your census and your malaria program uses denominators that they've calculated based on some survey they've done in the field, right? And ideally, you would want to center your data around singular denominators so it's more comparable. But if it's not the case, you can compare those denominators as well and see if there are significant differences. We can also compare denominators that are similar, things like your survival, estimated survival and your population less than 1 year. You can look at things like comparing your coverage rates with the number of births, etc., and just making sure there aren't spikes. You can also do things like growth rate, where you can calculate your growth rate over time. This is just looking at the growth rate of births, right? So there's obviously other factors here like immigration, people coming in and out of your country, whatever it might be. But this is just looking solely at births. Same thing, right? You're just looking for differences more than 10%. If you have a negative growth rate, well, it could be problematic for your economy, I guess, but you could talk to a demographer about that. That just means your population is decreasing based on birth rate. If you have a positive growth rate, that means your population is increasing over time. Okay, but what you're looking for, once again, are differences of 10%. So yeah, there's a number of ways to look at denominators, and a lot of them are predicated on making sure you have access to some type of external data, as that can help you define, your comparison versus, taking your data and comparing it to an external data source. You can bring that into DHIS2, and then you can get these types of analyses that I'm showing you up at the top here. But you can do internal comparisons as well, whether that's data you already have between different programs, whether it's kind of just overlaying information that you already see in different programs that you already have available. Obviously, you can calculate your own growth rate based on the denominators that you have present. So a lot of this can be done, at least initially, without this exercise of bringing in external data. Though external data will really help you, I think, supplement your analysis as well, and allow you to get a bit more insight into the data that you have. Okay, so yeah, I'll just go quickly into some of the other stuff. So we spent a lot of time now on the identification component here, going over the different metrics that are available, and discussing these further. I know it's quite a bit of information. Just a reminder, we do have an academy next week that will dive into each of those concepts in a lot more detail. But then, once you've identified them, you need to fix them, right? So fixing them often comes down to having clear guidelines for what you want to do when you identify these issues, right? And we really recommend basically that some type of SOP is in place and that SOP gets enforced. We have an example, a template SOP, that's just available as a resource. It's within this presentation. It's just to help you get started. It just outlines, the responsibilities of different levels, what they should be doing, It outlines the different checks that they should perform at the bottom here. What are the specific metrics they should look at? What should they do when they find a problem? What is the procedure for contacting someone to fix these issues? Maybe data gets locked and you need to unlock it in order to change the value. So what is the challenge there? Maybe data gets pushed to a dashboard that's available publicly. And once you start altering the data, your coverage rates start to change. So there are a lot of considerations here, depending on what you're doing and what your procedures are. And it's just something to think through a little bit more as you're going through this, right? So each place will be different, and that's why we don't have one recommended strategy. But we've tried to outline basically within that SOP template, what you should cover ideally, and it's just to get you started. You might have something in place already that you could supplement. You might want more detailed guidance. Of course, is that SOP document is more of a broader view. You might also want to discuss how you will enforce that to make sure that people are following through. And of course, this requires significant training in order to roll this out and make sure that people are following this the way you've designed it. Okay. So once you've started to kind of implement ways to fix that, you might also want to track, you know, whether or not this is being fixed. So we have developed some tools basically that allow you to monitor whether or not things are changing over time, right? So basically, and the two examples I'll use are outliers and validation rule violations. So when we run these in DHIS2, and if I just go back here, okay. So here's an example of validation rule analysis. Now it gives us the report. It gives us the validation rules we've violated. It gives very specific information. Okay. But what I don't know from month to month is I've identified these, you know, um, next time I run this, if I have fixed it, it'll just be gone. Okay. It won't show it. So I don't know if I'm fixing them or not, right? Over time. It doesn't give me any indication, um, whether or not I'm fixing them. It also doesn't give me the true extent of the problem, as I'm probably not going to, I don't really run this for the whole country at once and start looking at results that way. It's going to be too overwhelming, right? Um, so we have some tools basically that can help with that. And I'll just scroll to the dashboard here. Okay, so I'll just pull this up. We were looking at validation rules. Okay, so in this table here, what we're seeing is the number of validation rules by month separated by organization unit, okay? And what this is showing me basically is the number of violations that are present, right? And I can see in a particular month, what it looks like. Now, I'm already in October or November, sorry, of this year. And I can see for November, I still have 62 validation rule violations. Obviously, nothing has been done. Nothing's been fixed, right? We want to see these values decrease. Doesn't mean they have to be zero. There's some cases, some instances where, it's completely acceptable, the data that's in there, even though it's being flagged. It doesn't mean that something's incorrect. But this gives us an indication of whether or not, you know, we should, are we're fixing these things or not, right? Basically, it tells us also how quickly we're doing that. So if I were to look at this, just the last month, maybe, I'd hope within a certain time period, based on my SOP, that some of these things do get fixed, right? So this can help us monitor over time whether or not we're actually fixing these issues that we've identified, and can help us keep track, within DHIS2. I can display these on my dashboard. I can get an idea for the total number that I have. I can get an idea if I'm actually, someone's going through and following the procedures we've outlined, and fixing all these challenges that we faced. Okay, so this is very helpful in terms of helping us monitor the fixes that we're implementing through our system. Obviously, that can be done through manual means as well, but we all know that's very cumbersome, very challenging to do in practice sometimes. So we did want to make sure there are some automated methods essentially to help you with that. Um, so there's an example for validation rules. Oh, sorry. And we also have an example for outliers as well. Same type of thing. And just zoom in instead. Okay. So showing the number of outliers that have been identified for a particular period, and same type of thing, right? You'd want to see those numbers reduce over time, rather than staying stagnant, meaning that, basically this is not helping you. No one's fixing these problems. I think it's also good to look at this before you perform your analysis on your data, on your indicators. If you do have a significant number of validation rule violations, if you have a lot of outliers still present in your data, of course, if your completeness is low, as well, then it might be hard to make conclusions about your data, given that so much information is not really correct. Okay, so yeah, we're getting to the end of the time here. Let me just, yeah, thank you for filling out the first quiz here. Okay, I'll just launch the feedback while I'm going through the last parts of the webinar here, and I'll look at the questions in a moment. Okay, yeah, I'm gonna go skip some of that. Yeah. Okay, wanted to discuss this real quick. Okay, so just real quick, there are some extra resources for implementation as well. We have a number of checklists that are present. Here, I just have a number of resources. So in addition to what you saw regarding the SOP, we have checklists that help you on the implementation side of things. This one, for example, discusses, kind of various tasks that you would need to consider or go through if you were to implement these checks or these tests within your own system, including all the kind of organization with stakeholders, all the kind of discussions you would have, the different configuration that you would need to do, and then some of the kind of training and other considerations that would be required. We went over the SOP. We also have a kind of checklists for lower levels of the health system, just to kind of give you some idea, what should they be doing on a month-to-month basis? How can your SOP be structured to make sure they fit all this in? Is there a significant behavioral change after you do that training, and whatever else it might be? So some of these tools can be quite useful and really highlight the extent of what you need to do. Just while that is going on. Yeah. So we have we're kind of wrapping up the time here, but I will look at all the questions to make sure I can answer all those. We have another webinar in French that'll be on Thursday. We have the Academy next week. If you haven't signed up, there's one more day. Wednesday's the last day to sign up if you're interested in going through this in more detail. And next year, early next year, I spoke, oh, it says 2025, I apologize. That should be 2026. We will have a webinar on the supervision, right? So this is the site assessment, the verification, where you take your data that you've entered in DHIS2 and you compare it with your logbooks, your registries, etc., in order to verify if that data is correct. So there's a couple upcoming events here that we did want to highlight. So with that, I'll wrap up. Thank you very much for your time. But I did want to look at the questions. If you're interested, I will go through and answer the remaining ones for those of you who want to stay behind. If you do want to ask a question in person, please feel free to raise your hand and I'll try to answer it that way. Yeah, there's a lot of questions about the slides. Yes, we will share all the slides. I see it's been answered. Yeah, this question about the quality index. Okay, so we don't have an app to calculate the index. I didn't talk about it today very much, but we do have an index calculation, and we're just kind of finalizing the guidance on this first and testing it a little bit more. But what this index calculation does, it basically summarizes all of your data quality inputs and gives you a summary output, whether it's by program or for your entire system. We will be discussing it in the Academy next week in quite a bit of detail. There's a dedicated session on the index. So that would be one place to learn more about that. We will also be releasing guidance on that at some point next year as well. Okay. Yep, once again, a question about blanks versus zeros, so we've covered that. Yeah, and then tracker programs, I think tracker programs are different, of course. You could enter numeric data, but if you are missing data, you can calculate that a lot easier with a tracker program. Checking program rules. You can either have mandatory fields or you can do a check to check whether or not specific fields have the data you entered. One good thing about a tracker program or consideration for a tracker program we haven't discussed is you could say, okay, I don't know, you have a tracker program with 100 variables, and you say, okay, at minimum, every event should have these 10 variables filled in. You can check that very easily using program rules to say, okay, these are all the events in my program that have all these 10 variables filled in. These are all the events in my program that don't have these 10 fields filled in. And you can calculate percentages based on that. So it's a little easier to calculate missing data in that sense with a tracker program using program rules. Um, you can make some simple rules to basically define this for you. Okay, you're okay. About how to set this up in DHIS2, I see there's some questions about how to calculate this or the configuration. This is all available. So if I go back to the first slide here, in our documentation, okay? So here we discuss the configuration of all of these principles. So they asked about, yeah, so we discuss how to set all this up in maintenance. I'm sorry, just, yeah. So there's quite detailed guidance on setting all these things up. Okay, so if you're interested in learning more about the configuration, it's all documented here in the guidance. I would suggest you have a look at that. If you do have any questions, you can always contact us on the community of practice as well. But yeah, this guidance document outlines in all significant detail how to set up all of these different metrics, all of these different measurements. Okay. Can you configure so that NA facilities produce a minus? Yeah, you could, but I wouldn't suggest it. I think this would lead you, because if you say minus 99 and you're aggregating that data, then you're going to lose minus 99 for every facility that did report. If it's not supposed to report, then I would suggest removing it from your total. You don't have to have every facility as your denominator. I think that's also something we see in some of these systems where the denominator is wrong, basically, because you're saying that this facility is supposed to report, but in reality, they're not even delivering that service. So, you have to be careful there as well. And I would look at other methods before I start assigning extra data values, because then this is going to skew your data when you start looking at your final indicators, essentially. You're going to basically impose outliers that shouldn't exist by doing this. So I wouldn't do this minus 99 replacement. Moving. Okay. Okay, so there's a question here about using moving averages for scattered data in a line graph. I'm sorry, I think so. This was asked by Desi. Maybe you could clarify a little bit what you would like to see here. I'm not exactly sure what the question is. I'll look at some other ones. Yeah. Okay, so that looks like all the questions that we have for now. Yeah, thank you very much for your time today. I apologize. I'm 10 minutes over time here. You will have access to the yeah, in Spanish too. So I mean, in terms of, yeah, my Spanish is very poor. Unfortunately, I can't deliver the webinar in Spanish. We'll see if there's enough demand for something like that. I know we're having the French specific webinar. But in terms of at least all the tools and everything like that, you can get them to work in Spanish. So everything that I've shown you, while it's in English, obviously it'll be a French webinar on Thursday. It'll show you all the metrics and everything in French, everything translated. And then, of course, you can translate this to any other language you would like. Though I understand maybe some delivery of these webinars in Spanish would be appreciated. So we'll consider if that's something we could do in the future. Okay, thank you everyone for your time today. If there are any other questions or comments, there was a question about moving averages. Maybe if the person, Desi, who asked this question, if you could post this on the community of practice, then I could maybe help you out there and get a little bit more information. we can see if we can help you work through that. For everybody else, once again, if there are any other questions, please feel free to post them there. You will receive the recording. The recording will also be available on YouTube, and we'll also post the slides on the community of practice um, and allow you to do this. So yeah, okay, there's a final question here about minimum and maximum for each cell. So we have a specific tool in order to do this. There is a built-in feature in DHIS2, but we don't suggest you use it because it doesn't really work out the way you want. We do have a tool for this. I'm not going to be able to cover it, but I can share. I'll add this link to the presentation. It's called the Data Quality Workbench. It allows you to set minimum and maximum values for your entire DHIS2 system. This is the tool I would suggest. We're still developing this a little bit more, but I would say it's definitely more accurate than what we have in terms of what's built into DHIS2. So this is a possible way to do this. There are other methods as well that you could use to set your min-max. What I would say is just don't use the built-in DHIS2 functionality for now. It doesn't really work the way you want, but at least we do have an additional tool you can use, this data quality workbench application. We'll have a specific webinar actually on this next year going into this data quality workbench. But yeah, we don't have enough time today to discuss that exact configuration, but I can share this link at least so you can have a look at it as well. Okay. Yeah, I noticed most people have started to leave, but yeah, if there are any other questions, I'm happy to answer them. If not, then I think I've gone through the rest. So we'll share everything with you and make sure you get access to that. We'll share the links that I've discussed. Most of the links are in the presentation already as different resources, so you will be able to access that. Um, and yeah, we have a couple other events if you're interested. And yeah, thank you everyone for your time today. Apologies, I was a bit over time. And hopefully this was helpful for you all. And yeah, we'll touch base again. Like I said, we'll have the other webinars coming up. We'll have the Academy next week. There'll be a lot of specific material on these concepts here. And yeah, thank you for your time and hope you have a good rest of your day.